I'd like to welcome to our stage our special guest who's joining us today from the University of Montreal. Dr. Jean-Pierre Vaillancourt is a full professor at the College of Veterinary Medicine at the University of Montreal. Dr. Vaillancourt brings with him a wealth of experience to share with you today, including over 250 scientific presentations worldwide on biosecurity and contagious poultry diseases. He has advised animal industry leaders and government officials on biosecurity and regional poultry disease control in the USA, Canada, Mexico, France, Belgium, Italy, Switzerland, and the list goes on. In addition to his position at the University of Montreal, Dr. Vaillancourt has served as coordinator for the Quebec team for the design and implementation of emergency measures for the poultry industry. So that would be like our counterparts for the poultry emergency management team. So we are very pleased to welcome Dr. Vaillancourt to speak with us here today.
I'm going to start with a quote from Charlie Beard. Charlie Beard is actually the guy who invented a lot of the diagnostic tests that are being used today to diagnose Newcastle disease and avian influenza. So he's in the Hall of Fame in the United States. And in this quote, he's saying, you know, we got to go where the birds are. That means we need to really pay attention to the growers and start there in terms of biosecurity. I'll go past that and say, yes, that's right. It is very good to focus on the growers. But right now, the arrows that you see that I'm highlighting, all these people are not growers, they're employees. One thing I've noticed in the United States, in Quebec, in Ontario, New Brunswick, where I've gone, is that a lot of effort goes into training growers, very little as far as training employees. And they are really on the front line, and often, and you'll be surprised, tomorrow I'm going to show you data to see how little some of these people may know about disease transmission. So that's an important point. We have to go from the grower, for sure, to the employees, to the service people, anybody going to the farms. And that, as was mentioned before, in the first 24 hours, these people need to be somehow contacted, and they need to know what they're supposed to do. And then 2004 brought us AI in BC, but also 2003, 2004 in Delmarva and elsewhere in the world. And here, Charlie Beard changed his quote a lot simpler: we need a paradigm shift. What he meant there is that it's good to have good biosecurity at a farm level. That's the essentials. But it's not enough. You need to have a regional perspective. If you don't have that, you're not going to be able to contain a disease like avian influenza. Here I'm quoting, and that would be it for quotes, Eric Gunder. You can see him. You can tell this guy is not practicing in Red Deer, Alberta, the way he's dressed. He's from the south of the U.S. He's responsible for the health of more turkeys than what we are producing in Canada. This guy has a lot of experience. And the first thing he said in terms of changing our state of mind is that it's not because the schedule says we need to move birds that we've got to do it, if we've got any concerns. That's the first thing. And the second thing, if you look at the quote, he's saying if we could have prevented the index case, you know, the first case all the time, we would be out of the infectious disease business, and we're obviously not. So what he's saying is the name of the game is to concentrate on a rapid report of unusual situations, because when an epidemic hits, this is how it feels, you know. It seems to be coming from nowhere, and it hits really fast, and it will surprise you. What's the history of a crisis? Essentially, there's two phases. You got what I call the gray zone, pre-epidemic to confirmation of disease. And then you've got the epidemic and impact management. Impact management, by the way, is whatever you're going to have to do to deal with the consequences of having CFIA telling you what to do, okay? And they will do that. By law, they have the power. They will make these decisions. That's based on international agreements. So if at all possible, you want to avoid going too far into an epidemic. So we have to focus on the gray zone, and that's basically partly the first 24 hours. Time is of the essence. If you have a great plan, well executed, good diagnostics, you will limit it very often to one case. If you have a poor plan and delays, you're going to see more cases. And if, of course, you have poor execution, then you're going to see a lot more cases. Here I want to stress one thing. The picture you see there is from 1998 in Quebec when we had the famous ice storm. I say that because when I talk to growers in Quebec, they'll tell me, you know, less now, but the beginning a few years ago, they would say, you want us to get ready? Well, I tell you what, in 98, okay, when the ice storm hit, we lost electricity and everything. We pulled ourselves together, the industry, and we reacted. We can react quickly. I said, that's fair. The thing is, within 12 hours, 24 hours, you know the damage and you know where it is. It's a static situation. When you're dealing with an infectious disease, you don't know where it's going to hit next. It's very much a dynamic situation. And when you're not prepared, it can get quite bad. When I was in the United States, we had to face AI in Delmarva. We ended up with 197 infected farms. Why? They had a plan. Of course they had a plan. These guys are producing 2 billion birds in Delmarva every year. They better have a plan. But their plan had not been practiced for years. The government had reduced diagnostic capability. They didn't know where they would put the dead birds. They knew they had to put them somewhere. It took them over 3 weeks to decide how they would manage things. Look what the epidemic did. It just took off. And it took several weeks for them to get out of it. In England, with foot and mouth, they had a similar situation. And some scientists looked at what would have happened if they could have called infected farms within 24 hours and neighboring farms within 48 hours. And you can see this is the kind of curve that would happen. Cannot prevent everything, but we can reduce a lot of damage. But that depends on what you do, how you do it, over the first 24 hours or so. So what are the priorities? Communicate with your vet. I didn't see before coming here the part, so I'm kind of glad that I'm matching the information being provided, okay? I'm kind of going like the Cirque du Soleil with no safety nets here. Implement site quarantine, your self-quarantine thing, that's excellent. And I'll show you briefly how they do it in North Carolina. The first thing they do, communicate with expected service people. What I mean is people who are supposed to be on your farm that particular day. And you need to have basically a decision tree, a pre-established action plan to deal with things in the gray zone. And when I say you, the grower and also the grower's organization. You need to have people trained to look for diseases that are important. It's good to look at the definitions. It's good to look at the pictures, but your job is not to become diagnosticians. That's why we have specialists doing this. All you need to do is to be able to pick up that something is just not right. And that should trigger the first set of actions. Production parameters, for example, also should be a consideration, not only clinical signs. Now I say here, internal reporting of suspicious lesions. What do we mean by internal is that we're not going to CBC with that information. It's perfectly okay to share information with other people within the industry as long as it's done properly. You need to realize one thing though. The veterinarians in Canada and animal scientists who are members of professional organizations have to deal with confidentiality. Okay, if I'm a vet for your farm and I think you have a serious disease, let's say it's ILT, okay, I cannot turn around, call my colleagues, well, maybe in Alberta, but in Quebec, I could not call my colleagues and tell them, so-and-so at this particular address has got ILT, or I think he does. We have confidentiality issues that we need to look at. So we need to set up that communication system and develop operating procedures, and you seem to have something going on here, and that's very good. It's easier said than done communicating with others that you might have on your farm an infectious disease because of embarrassment. Some people are looking at that as being bad, of course. It's nothing great. And also, it may have an economic impact, and you don't know for sure whether you have something serious. It's not because you have some clinical signs and productivity is down. It could be a toxic problem with the feed, the water. It doesn't have to be an infectious disease, but perception is reality, and that could be a lot of complication. But here, allow me to quote a great Canadian philosopher, Bobby Clark, who says, I've discovered that the less I say, the more rumors I start. And our experience in North America with epidemics is that not talking is really the best friend of all the viruses and bacteria that we're trying to fight. Because controlling these diseases is a communication game. And if you do not communicate effectively, they're going to take advantage of that. Now for the quarantine notice. I didn't